All right, lots of changes to the pandemic in this the landscape in this pandemic, I should say, this week. I want to get to your questions. Let's bring in Dr. David Winter from Baylor Scott & White Health. Good morning. Good to see you.
Good morning. Good to be with you.
So, Dr. Winter, we know this week the CDC changed its mask guidance. New data out this week shows that vaccinated Americans are able to transmit COVID-19. So, first of all, for those of us who are vaccinated, as new cases continue to rise across North Texas, really all around us, what should we do if we're exposed to the virus?
Yeah, so if you're exposed to someone who has the virus and you have no symptoms, you should quarantine. We know you can actually spread it. You should quarantine for 10 days. Now, testing early on in the disease is not very accurate. So if you think that you were exposed but you're okay, have no symptoms, the day 3, 4, or 5, you could get a test. And if that test is negative, then you could stop the quarantine. But realizing that we can spread it even though we're vaccinated, new rules. You need to quarantine if you're exposed.
So with all this happening, how do you still make the case to unvaccinated people to get the vaccine? Because we're hearing about more of these breakthrough cases, you know, people who've been fully vaccinated, but they are still getting infected.
Yeah, it's a very important question because if you've been vaccinated, you might get the illness. And I've had a dozen folks this last week who've come down with it. They've all been vaccinated and they have mild symptoms. They act like they have a common cold. So if you've been vaccinated, you're guaranteed you're not going to die, not going to get really sick, won't have to go in the hospital. If you're unvaccinated, though, the rules are off. That's the case for the fact that you should get vaccinated.
Okay, so let's say you are unvaccinated and you're exposed. I've heard the first thing to do after testing positive is ask your provider for monoclonal antibodies. So at what point should you do that? Let's break that down, sort of like what are monoclonal antibodies? How do they work?
Yeah, they're a protein made in laboratories, Sonia, that work to augment your immune system. So if you get sick with COVID, your immune system ramps up. This comes from the other direction, like two armies fighting one battle against an enemy. So it does help quite a bit. Now, not everyone qualifies for that, and it does take like an hour to get this in a hospital or emergency room is where we commonly get that. So if you're over age 65, or if you're between age 12 and 65 and have diabetes, high blood pressure, heart, kidney, liver disease, are immunocompromised, or overweight, all those qualify you to get a monoclonal antibody.
Okay, and so they're pretty hard to get. You mentioned getting them at a hospital. Is the process just talk to your doctor?
Yes, most major emergency rooms have this available. You have to have an appointment there, so call your doctor, get an appointment, or go to the emergency room and tell them that you've been exposed. Sometimes that works also. Understand it takes about an hour to get the infusion. It's an IV, and then about an hour to watch for side effects. I've sent lots of folks over. So far, they seem to have a good response to this, and I've seen no significant side effects. So if you qualify for this, I would recommend it.
So where do we stand, Dr. Winter, when it comes to research around treatment options for COVID-19?
Yeah, if you've got COVID, monoclonal antibodies is for outpatient use. If you're in the hospital, they've got some antiviral drugs. Those work. But for outpatient folks, if you don't qualify for monoclonal antibodies, you're still sick. We treat them like a common cold. You can take cough medicine, antihistamines if you're congested. Acetaminophen works well for aches and pains and fatigue. All those things do have some benefit, but no other good drugs have come out yet. Other things in the works. Hopefully we'll find some other possible treatments down the road.
You know, one of the symptoms that we've all heard about and read about, some people who contract COVID report memory issues, difficulty concentrating, this brain fog type of a feeling. Are these symptoms likely to lead to any sort of long-term issue, dementia, Alzheimer's?
Boy, that's a really good question. We know that if you get the symptoms of the brain fog or have trouble with your memory, trouble concentrating while you're sick with COVID, that means that the virus is affecting your brain. Now, does it cause long-term side effects? We don't know that yet. It's a concern, though. Another reason you might want to stay away from the COVID-19 virus and get a vaccine if you hadn't. Wear a mask now if you've been vaccinated even, because we know that we can still spread it from person to person even with a vaccine. The new news that came out this week.
Yeah, Dr. Winter, real quickly, I'm asking you to take out your crystal ball here, but a lot of other doctors I've talked to this week said, look, I think the worst of the pandemic is behind us. We're about to start the school year. I've seen some projections for early fall into the winter months. We've seen how the Delta variant behaved in India, which was a largely unvaccinated population with other issues. But here at home, do you think it's going to get worse before it gets better?
Well, I hope that those optimistic projections are true. I can tell you, we had a report this morning at Baylor University Medical Center. They say cases have continued to go up. We have 40 more cases that were new from yesterday, from the day before. We've tripled the number of admissions we've had over the past couple of weeks. So we're seeing this spike go up like this. I don't know if it's going to turn around soon or not, but I'm a little concerned right now. We're in the thick of this. We're already trying to staff up and hire more nurses and open up new beds, getting ready for the surge.
Yeah, and I've heard a lot about staff shortages too, and concerns about that moving forward across healthcare, really. Dr. David Winter, thank you so much for your time today. Really appreciate it.
Thank you, Sonia.
And y'all at home, look, we know these guidelines are constantly changing. Schools are updating their rules. There's a lot happening. We are staying on top of all of it for you. So for the latest updates, just head to WFAA.com/coronavirus.